Okay, chapter 21 and 22 we'll do together, musculoskeletal and skin. So with this, we will go ahead and start with chapter 21. The biggest thing is with skin, we're going to be in the L codes. We're looking at infection, just different things, disorders, dermatitis, eczema. So to be honest, there's not a really lot of coding rules in this section. Just make sure you look for that specific code. Dermatitis, again, why did they get dermatitis? What were they in contact with? Okay, so let's go down and just keep moving here. L27, a lot of times this is dermatitis due to substance taken internally. So this could be that we're going to need a T code for this too, from the poisoning. So we need again then refer to the L code. And here is a good example. Due to poisoning, you put the T code first and then the L code second. If it's an adverse effect, remember what is wrong with the patient goes first, and then the adverse effect code goes second. Okay, so pressure ulcers, we just want to make sure that we code where they're at. And then the next part is what stage is that ulcer in? So that is the biggest thing with pressure ulcers. Can't talk today. Okay, so we have cellulitis of the skin. Okay, if you have it with a injury such as a wound, burn, or frostbite, one for the injury and one for the cellulitis. Okay, and then we have cellulitis for the skin. A lot of times I'll do an extraction of that skin if you have cellulitis, so then we would throw in that procedure code, and it would be extraction for a root. Postoperative cellulitis with an ulcer. So again, as you look through here, there isn't, just as I stated, big coding rules. A lot of times you'll do excision or destruction for your root procedure. Debridement big, that's going to be for an excision, unless possibly they did a brushing, scrubbing, or washing debridement. Non-excisional, this would be classified to extraction, except when it's performed by irrigating. Then, of course, we would use irrigation. All right, other debridement, we talked about that already. Extraction for excisional, or for non-excisional, sorry about that. Excision for excisional. So extraction for non, excision for excisional. Okay, then we possibly would have some skin grafts, and that wraps that up. So I am going to go to the next chapter here. Let's go ahead and get started with the musculoskeletal system. So again, different things. We'll look at arthritis, myelopathy. So the biggest thing in musculoskeletal, make sure we know the site and laterality. Left, right, what bone. Okay, bone versus joint. So again, the bone may be affected at the upper end or the lower end, although the portion affected may be the joint. So again, at this point, the site designation will be the bone, not the joint. Okay, and that kind of goes back up to the one before it. Acute, traumatic, or chronic or recurrent. Kind of when we talked about injuries in chapter 13, make sure when you look up fracture, whatever, that you are coding traumatic. And then recurrent, again, you're going to be looking at that 7th character. Okay, disc disorders. Again, these are going to be your M codes. We could have disc herniation, myelopathy, herniated disc, surgery. With these, you're going to be again in the surgery section. Okay, you could be doing an excision, a destruction, depending on what they did. A laminectomy. With this, again, here it's excision or release. Arthritis, what this is, it consists of a wide variety of conditions affecting the joints, muscles. It includes inflammation, we have swelling, pain, stiffness, and it can occur independently. Okay, so again, here's our little different things with arthritis. Osteoarthritis, again, right here. This is the biggest thing. Arthritis represents osteoarthritis. So again, it's probably going to take you back to that, vice versa. So just kind of look at the wording. If it's a DGD, it occurs in older people. It's chronic. All right. So again, there's not any big coding. We have rheumatoid arthritis. So with arthritis, just look to see what type that they're looking at. We have derangement, internal knee derangement, osteoporosis. Again, this is going to be leads to your pathological fractures, affects your bones. Like I said, with a pathological fracture, this won't be traumatic. So make sure if you're looking up a fracture that you go to pathological, not traumatic. And then you are also looking for the 7th character, initial, subsequent, routine, delayed healing, non-union, malunion. Okay, so with this, we have the 7th character. A is active treatment. D is after active treatment. G, K, P are used for subsequent. S is for, again, sequela. Stress fractures, we have femoral fractures. Again, this just talks about all of your good fractures. We have hip replacements. The biggest thing when we do these is how did they replace it? What did they use? Okay. A lot of it is going to, possibly ceramic, maybe metal. Again, it's going to be all in the doctor's notes so that you know how to code that. We have ankle replacement. ICD-10 PCS do not indicate bilateral replacement, so you're going to need 2 procedure codes, one for the left, one for the right. We also have an aftercare Z code, joint revision, spinal fusion. Once again, I know I'm going quickly, but just make sure you take your time. This, once again, is just a really good anatomy lesson. That's about what I can say for, that's why these last few chapters happen fairly quickly, because I think they cover more anatomy than they do coding rules. So basically, if anybody has any question over this PowerPoint, and which is chapters 21 and 22, just let me know. Read through the chapters, do the problems, and keep me posted.